Okay, we're here today to do just a general abdominal assessment on a patient. Of course, we're going to knock on the door, ask to come in. Once we're granted access, we'll come in, approach the patient, and let them know of our intention. We're going to be doing an abdominal assessment. Shouldn't take long. And we will first ask the patient if they have voided yet prior to the assessment. If they have not, we will ask them to excuse themselves and go void. After we've determined whether they voided or not, we will then go ahead and explain to the patient we're going to be doing an abdominal assessment on you today. I'll be doing some light touching. I'll be listening with my stethoscope and doing also light percussing, which is listening for sounds as I tap on my hand. I'm going to talk myself through the entire assessment so that you know exactly what I'm doing when I do it. So first off, we want to expose the patient properly. Of course, after putting on gloves and using all the safety measures, we're going to make sure that they're laying in correct position, which will be supine with their legs slightly flexed for comfort. Then we'll approach the patient. We'll expose the according piece of body only and not anything else. And the first thing we're going to do is we're just going to look at your abdomen. I'm going to be looking for color, shape, contour of the abdomen, whether I see any discolorations anywhere, any ecchymosis or bruising, any striae. Also, I want to take into fact the umbilicus. Notice that, make sure that is midline, and notice the color, shape, and contour of the umbilicus as well. And also visually inspect for any palpation, any pulsations, any masses that I can see, any unevenness. That will be the first order of our abdominal assessment. Then we will go into auscultation. After auscultation, we'll go into percussing, and then last palpation. So in auscultating the patient's abdomen, we first want to warm up our stethoscope using the diaphragm, not the bell. We'll warm it up for the patient's comfort. And upon auscultating, we're going to start in the right lower quadrant of the patient. And what we're going to be doing is we'll be listening for a full 5 minutes to make sure that we do not hear the absence of bowel sounds. Again, we're going to give it a full 5 minutes before determining that there are no bowel sounds. And yeah, let's go. Here we go. So again, right lower hand quadrant, working our way clockwise. Perfect. Bowel sounds present, all 4 quadrants. Also, if your patient has somewhat normal bowel and GI motility, there should be about 5 to 30 normal bowel sounds per minute. While we're auscultating for bowel sounds, we're also going to next auscultate for the aorta, any bruits in the aorta, and then we'll do the subsequent iliac and femoral arteries as well after, as well as the renal. For that, we're going to use the bell of our stethoscope. We'll start with the aorta, again with the bell, just above the umbilicus, listening for any bruits, which is a brush, a quick thrust of any fluid. Again, starting at the aorta, and then we'll go down to the renal, then down to the iliac, and lastly we'll end with the femoral arteries. Beautiful, no bruits present. After we have auscultated, we will then move into percussion. And again, percussion is just, I'm just going to do a light tapping, assessing for tone. I'm listening for certain tones. Over areas where there are organs, I should hear more of a dull sound. Over areas of more open space, I should hear tympany. Okay, so again, I'm going to start in the right lower hand quadrant and work my way clockwise. Beautiful. And then lastly, we'll move into palpation. We will start in the right hand lower quadrant. Again, work our way clockwise. What we'll be palpating for are any rebound tenderness, any rigidity, any pulsations that we feel, any organs that might be swollen or inflamed, such as the pancreas or the spleen. And this is going to be light palpation. We're not going to go too deep. Again, any pain anywhere. So we'll start in the right lower hand quadrant, and we're just going to be lightly palpating any masses, rebound tenderness, rigidity, any pulsations that we can feel, any swollen organs. And that concludes our abdominal assessment. Thank you very much.